Are you positive you know who I am?
How do you know? It may seem like a very simple question, but if you don't ask and check, it could have far-reaching consequences for your patients. A mistake was made which led to one of our patients having the wrong procedure because a fundamental identification check was not carried out. Fortunately, in this case, the patient did not come to any harm. But the outcome could have been different. This should never have happened. Think about the interventions you carry out on patients daily. If you had the wrong patient, how would you explain how the mistake was made? To ensure that we don't make the same mistake again, follow these simple steps. Use positive patient identification approaches. Ask the patient their details rather than telling them what they are. For example, ask them their name, their address, date of birth, rather than saying, "Are you Mrs. Kaur of 1 Anywhere Street with a date of birth 1st of November 1979? In the case of common names, ask additional questions. For example, their telephone number, their GP, or their GP's surgery. Identification wristbands are used as a secondary source to validate your positive patient identification, not as the main one. Red wristbands are additionally used to identify patients who have an allergy. For most of our patients, ID wristbands are not used, so the only way you can be sure that you are with the right patient is to ask. When patients are called from a waiting area, this adds an extra dimension to the identification process. Remember, staff may have accents. Names when called may sound similar. The area may also be noisy, or patients may be hard of hearing. So, speak clearly and double-check who they are when they're in a quieter area before you carry out any procedures or treatments.